That, does that, I mean, obviously not a very different character, Claire, but that sort of period where just to talk about when the reality hits is a really tough time, isn't it?
Yeah, it's horrible. Yeah, and there's nothing anybody can say to change the situation. It's a grieving process that you have to go to, and people, you get asked a million times, are you all right? Can I do anything? And you just want to go back to the old life, but of course you can't. So I had one counsellor say to me that you're on a tightrope, and on one end you've got your friends holding one end, and on the other end you've got the family. And if you fall off, you feel like you're going to take everybody down with you. So you put on a front in a way, a chirpy front to try and get them through, when actually you're the one sometimes that just needs to crash. And,
so you feel responsible for them rather than you?
You do, yeah, strange.
So how did you ever ask for help?
From?
Anybody?
Yes.
You did?
Yes. I couldn't do it on my own, because I'd been the carer for family members, and they needed all of us, and so it was now my time to instill all the help from people around me.
So you were unabashed about asking?
Yes.
How can we make this better, Chris? And then Peter?
Look, I've been in this situation many, many times, and it's extremely difficult. And to defend people like myself and Peter, we're often not just one referral away from the GP. We can be 2 or 3 referrals away from the GP. That's the first point. And the second point is that not infrequently the patients themselves don't have a real close relationship with the GP. They may, for example, have gone to an after-hours clinic with some irregular bleeding, had an examination, been referred to a gynaecologist, been referred to a gynaecological oncologist, had an EUA with the radiation oncologist present, been scanned, diagnosed as having locally advanced disease, and find themselves sitting in my consultation room 5 steps away from that initial consultation. So it is a problem. And they often get to know our team really, really well, because it's a very intense time, and there's a whole bunch of stuff. So that becomes their clinical home rather than the GP. And I get it from the GP's point of view, and we do our best to correspond. How much better than that you can make it, it's hard to be certain. Peter?
We run the same problems that Chris does. Within my department or our department, we absolutely make it a rule that when the referring doctor, the list of doctors that we correspond and call include the referral specialist, but GPs, and the patients have the opportunity at every time to put down who their GP is. But we find the same thing Chris does. Quite a lot of them don't have a regular GP.